Hello, everyone. I'm Saleha, and this is Chai, Chat, and Community. Before we start tonight, I would like to acknowledge the traditional custodians of the land on which I live and work and pay my respects to their elders, past, present, and emerging. Tonight, we talk about diabetes awareness. And joining me are two amazing doctors, Dr. Nafees Shadem and Dr. Haroon Kasim. Beemajan Yussouf is having some problems logging in. So, as soon as she logs in, she will be on our show. Hi, Nafees. Hi, Haroon. And thank you very much for joining me tonight.
Thank you, Saleha. Hello, everyone.
Hello, everyone.
Haroon, let's start with you. Can you tell us something about yourself, please?
Yeah, so I'm a doctor in Sydney. I'm a generalist, so I'm not a specialist. So I know a little bit about everything, and we also manage diabetes. And thanks for calling me. I mean, I certainly think that a very important part of such diseases is patients being self-empowered, and we have two great people here who have amazing stories that has a lot of lessons for us on how patient empowerment helps people manage their condition better and just live normal life like anyone else. So I think beautiful stories here that we can look forward to listening to.
Thank you, Haroon. Nafees?
Hi, my name is Dr. Nafees Aamer. I moved to Australia just 2.5, 3 years ago. Currently, I'm preparing to get my degree validated as per Australian standards. And I have a daughter who's 6 years old, who's got diagnosed with type 1 diabetes when she was around 4.5 years old. Um, and I am very passionate about creating awareness for type 1 diabetes and showing people that it's not what it was a few years ago. It's not the end of the road for you or your child. You can always live a normal, healthy life and do everything that anyone else can do. Thank you.
Um, I am here. I'm just sending Bima the link again because I think she can't join. So please bear with me while I send her the link again. Um, Sorry. So, um, Harun, please tell us what exactly is diabetes and what are the different kinds.
Yeah,
And can you please explain it to us like in a
yeah,
layman's language?
yeah. So diabetes
Thank
is
you.
we all eat, and once we eat, we get sugar in our blood, and it's normal. And
Yeah.
there are ways that sugar is managed, and there's a hormone called insulin that helps us manage the sugar. What it does is it pushes out the sugar so that your muscles can use it, and so your sugar levels within the blood are not high, right? Then they're used for the purpose they're used. Sometimes what happens is one of two things happen. The insulin, which drives the sugar into for use in other parts of your body, is not enough. It's not secreted enough, right?
Yes.
By the pancreas. The pancreas is the organ that secretes insulin. And other times, what happens is it's secreted okay, but somehow the body becomes not just as sensitive. So the first one, where it's not secreted enough, is called type 1 diabetes. The second one is called type 2 diabetes. In some instances, when women are pregnant, there are other hormones that are there
Yes.
during pregnancy that makes the body to be less sensitive to insulin, and so that's called gestational diabetes. Gestation is, as you know, being pregnant. I think it's an English word. Yeah, it is an English word. So
Yes.
gestational diabetes, right? So those are the three, and then you have other kinds of rarer types where you have again genetic defects in the insulin or how the body responds to it. So that's going into really the nitty gritty. So let's keep it simple. Really, three big ways. One, where the pancreas is not able to do its normal job of secreting insulin. So in that case, what you need is you need to give insulin. So that's why it matters, right? And they cannot they need insulin. They cannot not be without insulin. So that's one. Number two is where the pancreas is secreting the insulin, but the body is not sensitive enough to it. And so what you need to do is you need to make the body more sensitive, and you can do various things to and we'll come to that. And the third thing is gestational. So what we're going to cover today is because diabetes, you have endocrinologists who study that all their lives. So we're not trying discover all of diabetes today. But what we might do is the common theme on type 1 diabetes. Type 1 is a type of diabetes, where the insulin is not secreted enough by the pancreas, right? The question is, well, why does that happen? The honest truth is, we don't know, but there are a few reasons. There may be some genetic issues involved. There may be, sometimes it occurs because of, immune system that damages the pancreas, and sometimes it occurs because of illnesses. So regardless of what causes it, right, what we need to do is understand how we manage it. Okay. So the management really sorry is just so the management really is first simple stuff, like making sure that you have a reasonable and healthy nutrition, right, where you're not taking too much sugary stuff, more vegetables, more protein, and watching your diet, and then what you do, and then a part of that, of course, involves understanding what carbohydrate foods are, and I'm sure Nafees and Bima will talk to you
Yeah.
about that. And carbohydrate counting. So carbohydrate counting is important so that how much insulin to give and all of that. And there's also a thing called glycemic index, which again Nafees and Bima will be talking about. And then as we move, so that's one thing. So you kind of watch what you eat, and it's not as horrible as it sounds. It's actually what you're really doing is having a healthy diet, and there's nothing wrong with having a healthy diet. And I'm sure Nafees and Bima will talk about it. And then what do you do is once you have your diet, what of course you need to do, there are things about alcohol. You see, alcohol is something you best avoid for various reasons. It can drop your blood sugars and you become inebriated. You may not control your sugars very well. So there's alcohol, food that we talked about, and then what we do is we obviously learn to check our sugars, right? So when do we check our sugars? We check our sugars in the morning, right, or 5 minutes before a meal, and 2 hours after a meal, right? And that'll vary. Sometimes your sugars are all over the place. You get up in the middle of the night and check it occasionally.
So
And
we can check sugars at home now, don't we? We
yes,
have
yes.
the
So
apparatus. Yep.
yeah, there are some really exciting devices which Beema is very passionate about, and I'm sure she'll talk about it. So you have these simple devices, so yeah, so that is a flash device,
Yes.
You're
and what
wearing
you have
one of
to,
them. Okay, Bima. Yeah.
so you can scan it, and you can scan it about, and so that way you have a 24-hour reading,
Yes.
right? And and,
Yes.
and, and then you have continuous monitoring devices. So
Yes.
once you monitor your sugars, obviously you have to do something about it. Once either your sugar is high or it's normal. Normal, it's fantastic. I mean, it's within the normal range, or it's low, right? So the most scariest part is the low sugars, right? Because that can kill you. You know? I'm sorry to use that word, but it's dangerous, right? So, well, what do you do is, once your sugar is low, you have something, right? You can have some lollies, you can have some 3 teaspoons of sugar, honey. So you take something immediately. You check your sugars first. If you can't, how do you know that? You'll feel lightheaded or irritable, and you might feel some sweating. So those symptoms. So if you have that, what you do is you check your sugar. If you can't check your sugar, most people actually know. Some people don't know, actually. That's even more scary. But a lot of them know when they get their hypos. So if you can't check, that's fine. Have something to eat and check your sugar again when you can, so that the sugar goes up, because low sugar will
So
kill you, right?
low sugar is terrible.
It's horrible, yeah, because it's life threatening. So you take something, and there are various things you can take, like we said, lollies, glucogel, and all of that, and then check your sugar again. So that is to bring your sugar up immediately. Then you take something that lasts longer, like a bread or some milk, so that the sugar lasts longer. So after, what you do is you find out why the sugar went up. Right, went low, right, and that could be because either you're taking too much insulin, right, or you've taken insulin, way before your meals, right, or way after your meals, right, or you're sick, right. So the various reasons. Then the way to figure that out is not to become a doctor yourself, but to work. I mean, you will. eventually you'll be the expert actually. But initially what happens is it's always good to work with your doctor and your nurse, and what they will, they will look at it and tell you this is what's happened, and then you'll recognize a pattern. And
So
after a
you have
while
to
you
find
know,
the sweet place somehow, when your sugar
and,
is
and
not
yeah,
low, when
yeah,
it's high, when it's
yeah.
perfect. Okay.
Yeah. But to again, I'm just saying this because it's a dangerous thing. But as Bima and Nafees will tell you, it's not as hard as I'm making it out to be. I'm sorry if I'm coming that way, right? It's just something you need to be aware of, but it's easily managed. And again, they'll talk about it. Then if your sugar is high, again, you have to figure out why the sugar is high. You're not taking too much. You're not taking enough insulin, or you're too sedentary, right? And sometimes what happens is if you have an infection, right, the sugar goes up too. Okay,
Yes.
so you manage the sugar that way, and what happens is, once you manage your sugars, um, what you're aiming for is a thing called HbA1c. What the HbA1c does is it checks your sugar control over 3 months, and your doctor will give you a range where it should be, right? And you can work on that. So that's the sugar bit. Now, coming on to the other bit, so very often type 1 diabetes also has other problems. The other problems meaning, it can affect other parts of your body. It can affect your nerves, it can affect your eyes, it can affect your feet, right? So what happens is once you see your GP, he will create a healthcare team, right? And they will tell you when to see your eye doctor, when to see your foot
So
doctor.
what happens to your eyes? Do you start losing vision?
No, you don't, but there are some changes in your eye that that can be problematic if you don't treat them. But the good news is that because you see your ophthalmologist regularly, they do some preventative treatment and you
Yep.
prevent loss of vision, right? So that's one thing. The other thing, of course, is seeing the podiatrist, making sure that your feet are good, right? Seeing a dietitian who will help you with your diet, right? And I think there's a very strong argument these days that seeing an exercise physiologist may also be helpful because they help you with exercise and activity and all of that. And your endocrinologist. What your endocrinologist will do is he'll find out if sometimes what happens is with diabetes, your other organs are affected. I mean, there may be other endocrine organs that may be affected, especially in type 1 diabetes, and they may look for antibodies and all of that. And so they'll keep an eye on that. So your GP, your endocrinologist, and those healthcare providers, dietitian, they all will manage that, and
So
they'll
you work
advise
with
you.
a suite of doctors, basically, each
No,
one
no,
telling you what to do.
no, there'll be two doctors, right?
Oh,
So
just two
what we have,
doctors. Yep.
yeah, well, what we have to understand is the person who drives all this, and this is really important. That'll come out of the both of the talk, will be yourself, right? You will say, "This is my lifestyle, and this is how I would like you to work around me," right? And then the GPs will try and tailor it. So it's not a bunch of people ordering you around, but you telling them how you'd like your life to work around this. So that's what's really beautiful about how the diabetic care is evolving, and you'll hear more about that. In the end, there are other things that people, I'm sorry if I've taken too much time. There are other things that you will need to do from on a day-to-day life. You need to know if you can drive, and if you can tell, again, there are things around how you dispose your shops, right? When you check all of that, you need to know how to dispose your shops. Then there's a thing about these devices that Bima will talk about. There are two types of devices. One is the flash device that Bima was used. Another is called a continuous glucose monitoring device. So what that is there's actually a device that you put on your abdomen that checks your sugar and automatically gives you an insulin, preset insulin. Even that sometimes is problematic if you have too much food or less food, it can be problematic, and that has to be adjusted. And that's something they might teach you to. So that's a treatment. The other things in diabetes are things like your activity. It's good to have about 30 minutes of walking every day, 5 days a week. You're driving, right? If you're on insulin, right, you have to let the driving authorities know. I think, and the occupational therapist will advise you about that. And again, work, you don't have an obligation to let them know technically, unless and otherwise you're operating heavy machinery or something. Again, your healthcare team will advise you on that. So that's life, that's sugar, and that's how you see the diabetes. The other things like if your blood fats and all of that, your GP will manage. I know it's an awful lot of information, but I'm just giving you an
But
overview. But I
okay,
think it'll come out really nicely when you hear the Bima and Nafees' story, and that'll make it certainly a lot more understandable than a guy like me talking.
okay. I'll go to Nafees while Bima is trying to log in. I do have some good comments coming up, so here you go. Uh, Useful information. So yes, um, and there is Tej Singh who says, "Thanks, guys. Really gives insight information." There is another question, so I'm just going to ask the question while Bima is trying to log in. I think she's having some terrible tech issues. So, what should be the range, if applicable, for HB1AC in people between 30 and 39? So,
Yeah.
who wants to talk?
I'd let Dr. Haroon go,
Yeah.
please.
So the HbA1c is something that has to be personalized to your needs, right? Let's say if you have really low sugars, like we said, low sugar is really dangerous. So your doctor might decide to accept a higher HbA1c, right? So there's no absolute. It's something that changes depending on your lifestyle, what you do, what your sugars have been, right? And that's something that has to be discussed in consultation with the doctor. So it's very personalized. What's generally recommended is around 7, but if you're having too many hypos, you might even accept something higher. Let's see what Dr. Nafees has to say.
Okay. I'm going to ask another question, and then Nafis, I'll come to you. It
Yes.
says, how do we deal with diabetes if it is genetic? Do you want to take that question later? I can show that to you, because let's just share your story first about your
Yes.
journey. And yep. Okay.
Thank you.
Yes. And there are many, many questions coming in. So I will ask you all those questions. I wish Bhima could join. But anyway,
Yeah.
let's
Thank you,
tell us your
Sneha.
story. No, not
Thank
at
you,
all.
Saleha. And thank you, Dr. Haroon, for the concise but very insightful look into diabetes in general. It was very informative for all the viewers, I'm sure. So, my journey, I'm a doctor by profession. But to be honest, I have never dealt with diabetes as a specialty ever. And I was quite ignorant of insulin usage and how to use, how to dose. Like, if anyone came up to me about insulin, I would say I absolutely have no idea. And I think now, after being on this journey for 2 years, I would still say that, more than any doctor, a patient knows what to do with their own insulin. So, diabetes, I think type 1 is something where you become a mathematician, nurse, uh, uh, a nutritionist, everything into one, because you are doing so many jobs while you're managing your diabetes, especially type 1. My journey started around in 2019, where I have no history of diabetes in my family, no type 1 or type 2. And I picked up a few signs in my daughter. So that really helped. What really helped me is me being a medical profession. And I would love to stress to the viewers that if you ever feel that these signs and symptoms are visible in your child, in an adult, or in yourself, please get tested. It just takes a single blood prick to save your life or your child's life. And my daughter came up, it was summers in Australia, and she's not a very good drinker, and she was drinking water, she's drinking milk. And I just thought, oh good, finally she's improved, and she's getting on board with her health and listening to me. And then she started using the bathroom often, and it was not more than usual um, for any child, but it was more than usual for her as an individual. So I picked up these signs and I got a bit worried. So I would like to stress that the main signs of any diabetes, whether it's type 1, type 2, or gestational, would be feeling thirsty, wanting to go to the bathroom often, feeling hungry more than required. Even if your child has been very physical, or you've been physical and you've eaten a big meal, you'd still feel hungry, losing weight without any valid reason, and feeling just generally very tired more than usual.
Can it also be opposite? Do you always lose weight, or can you also gain weight?
That is in type 2. Yes, you will gain
Okay.
weight, and it will be very difficult for you to lose weight in type 2. So since we're talking about type 1, you will see that. And I'd like to stress that it used to be called juvenile diabetes earlier, but it's not anymore, because it's been seen that across age groups that they're coming up with type 1 diabetes now, whether it's not necessarily restricted to young children or adolescents like earlier. You see it in 40 years old, 60-year-old, 80 years old who are getting diagnosed with type 1 for the first time. And there's a lot of influence of environmental factors which have been causing that. So please, I mean, I have been a very big advocate for the signs and symptoms of diabetes, because it just takes one prick to save your child's life or your life. And took my daughter to the GP, because I, being a doctor, I suspected diabetes, but she wasn't showing full blown effects or signs and symptoms yet. And I was doubtful, and he saw her and he just put it past a UTI infection, maybe because she was playful, she looked healthy, she hadn't lost any weight yet. She was just drinking a little more water than usual. And he said, we'll just get her a urine routine and urine microscopic done. And he was so sure it's going to be a UTI infection in her. And I said, if I need to sleep at night peacefully, I need her to get her blood test done. I need her to get tested for her blood sugars, so that I know for sure that it's not that, and I can put it on other growth factors, growth spurts, emotional, well-being or something. And he got the blood tested, and he called me up because it was quite high, and he was shocked himself. Uh, I would like to say that as a parent, or as an adult, if you have the gut feeling that something is not right, you can suggest to your health professional that I would like to get this tested. Be aware, be conscious of what it can be. And it's been 100 years of insulin this year, and we can't thank Dr. Banting enough for giving insulin to this world. Uh, it's a condition. I would like to say, I do not call it a disease. I do not call it. I don't like to give the adjective of diabetic to anybody, because it's just a condition that has to be managed. And I like to put it in the same way like a person wears glasses because they need help to see. The diabetics just need a little help with insulin to go on with their normal life. I was very devastated. I thought it was the end of the world for me and my daughter. And the only thing I always heard from day one with the health professionals where my daughter was, is that in the current era, I think there's nothing better than having diabetes, because it's so easy to manage it. You have the flash glucose monitors or the continuous glucose monitors, and you have the pumps which actually act like artificial pancreas for you. And she is just going to be absolutely fine. I had my grieving process. I took a while to accept what had happened. But I think when you go past that and you look, your child can be absolutely normal. There's no profession anymore that diabetics cannot do, whether it's racing, whether it's surfing, diving, pilot, commercial pilot. It's every and any profession that type 1 diabetics can do, even if they are on insulin. So do not get disheartened. Do not feel like this is the end of the road. But that, as Dr. Haroon suggested, yes, you need to be aware of your body. You need to keep, I would say, you need to be aware of a balanced diet at all times. I mean, whether diabetes or not diabetes, I think a balanced diet is important for every individual, and so is it for a person who has diabetes. So keeping a good proportion of proteins, carbs, fibers in your child, I have seen keeps her healthy, mentally happy, and she does all activities that any other child can do, whether it's playing a sport, whether it's dancing, it's swimming, it's going for her play dates. I would say that keep your child involved in their management, because the more they're involved, the more independence they get, and the more awareness they have. So if I have kept my daughter involved and been an advocate for her care with the people in her school, with her friends, with her friends' parents, so that they know what to do and when to do. So my daughter is a little more independent now than she was a year and a half ago. She knows what she has to do when she's eating, when she's having a hypo, when she's going for sport, or she's going for play dates. And I think you build a support system, and you know that, okay, this is what you do, so your child is more independent and you're more independent in your own care. Uh, it is I think involving at sometimes, because you need to, create the awareness in your circle. Like whether when my child is in school, I have to go and teach teachers. They were very scared when we moved to Sydney of how it would be, because she was the first child that they ever had in years who was diabetic in her school. So she's the only child. But I think it just takes a month, and all the teachers, all the people are on board, and they know what she has to do. They don't even call, or they don't even inform me now. They know when to treat, how to treat. And my daughter knows what to do, and she's pretty independent when she goes for her dance. She knows what she needs to do before it. So I would say make it more involved and educational for everyone around you, so that they know what you're doing, how they're supposed to manage, and they're not scared. Because I think the first thing is fear, getting the fear out of your mind, your child's mind, and the society's mind. Because the moment they hear you're on insulin, they get scared. It is understandable, because it's something that you hear, that you have to you'll have hypos and you don't know what to manage. And I think that was the times, olden times, where we didn't even have blood glucose test strips available at our disposal at home. You don't know what is happening. I would really not. I mean, there's not enough that I could stress on using a flash glucose monitor or continuous glucose monitor. There's a plethora of data that you get from there, that you can use, and you understand and educate yourself on how you're supposed to use, what you're supposed to do, and how you use insulin at various times. Um,
So, Nafi,
what
sorry to interrupt you here. So, all the data and all the everything that you're saying, that a person should go to their GP and get all the information?
No, when you, at least for children for 21 years of age, I think in Australia it's available for free. A continuous glucose monitor or a flash glucose monitor. I know there are a lot of parents and children who feel that the device attached to their body is something that they're not comfortable with. Um, but I would say, if anything that you need to go through, I think you should have a continuous glucose monitor or flash glucose monitor, because it gives you a lot of information. And every diabetic has a different body, responds to foods very differently. So what works for one person may not work for you. You need to talk, educate, interact, learn, pick up the things that are relevant to you and your body, and use it. So I think once you have that information with you, is when you can ask those right questions to your GP, or to other people who are living with these conditions. So what I believed is, I took my daughter to the JDRF events a lot in the beginning, and she mingled with a lot of children who had type 1. And that was an amazing support that she got, because she felt very it was a obviously it was a change for her, from not getting a single prick in years, to having been pricked every single day, so many times a day. And so she was a bit, I guess, upset about being pricked so often. And when I took her there, and she mingled with other children, and heard them talk, and she heard adults talk, and she was like, okay, this is just something that I have, which a lot of people have, and it's it's not something that stops me, and nothing that I can, that can stop me. And I think you need to reach out. So when you have that information, you can use it to your benefit. So
I'm
I
going
would.
to come back to you about that. Just give me a minute. There are lots of comments coming in. So, guys, please hang on. We will go through all the comments. I will show all the comments. You have three people here who will reply to everything. Nafis, I'll come back to you in a minute. Hello,
Yes.
Bhima. You,
At last,
I,
I'm here.
you
At
are
last,
here.
I have been waiting for from. I started 7:45, and then I don't know. Okay,
Well,
it's all right.
this is
Finally,
why
I'm
we.
here.
No, you are here. So, Nafis has shared her journey. Can you share yours? And then we go through how you educate the people and what advocacy work you guys are doing. But if you share your journey, I will go through all the questions which are now in queue, and they're piling up. So I want you to answer all the questions. Between the three of you, I think you can take all the questions.
Okay, you
Okay,
can.
Bima.
Saleha, if I start telling my story, it'll take a 2.5 hours movie
No,
type of story.
let's take 3 minutes to tell your story. Then I'll go through the questions and come back to you.
Okay, I developed
Okay.
diabetes when I was 20,
Yep. Is it
and
hereditary?
No. It is. Of course, my father had diabetes, but this was a very special diabetes. What I have, like how Nafees said, I have type 1 diabetes, and later on, I also developed some kind of insulin resistance in my body, and all that sort of things. And when I developed diabetes, I come from a very conservative Muslim family where all these things are, has to be all under behind the doors sort of thing.
Yep. You don't
And
discuss
at
it
that,
openly. Yep.
yes, I didn't have my parents at that time. It was my grandfather was there. He was 110-year-old at that time. And of course, I had my 7 siblings around me, but nobody had a clue like what it is and how you have to manage it and all those things. Luckily, I got a very good medical care. And when I was in the hospital for the first time when I got diagnosed, the doctor who looked after me, he said, Bima, you're going to live until you're 80 plus. And then and then I said to myself, I'm so young, and I used to feel so ashamed to go to the hospital to meet, I thought, and all other people like who are in the waiting room, they'll be more than 50 years or something, and I'll be the youngest. And when I went to this particular hospital, it is a diabetes care and research center in Bangalore in India. And it was like I could see a lot of kids coming and going, and youngsters, they come to visit the doctor and like for treatment and things like that. And then I realized like we all should meet up. Then I spoke to the doctor and I said, I like to work with him. And he looked at me and he said, oh my God, you're such a shy girl. How can you do this, advocacy work and all that? Then he trained me to be a diabetes educator at that time. This was in 90s, early 90s. Then I did diabetes education for 6 years there before I moved to Australia. And in that 6 years, I started young people diabetes group where we were 300 people below the age of 25 years, and 90% of them were type 1 diabetes they had. And we were so close knit, and we had a beautiful platform in that hospital where we could really feel that we are not abnormal, we are more than normal. And we proved the whole world. Like we used to give classes, we used to give street plays, and we used to have invite people and speak on the media and things. Like every third month we used to write a write up on Indian Express to say that with diabetes you can have a very normal life. And today I'm here, like I have done various advocacy works and things like that. Like I can discuss, you gave me only 3 minutes.
I have all the questions for you, Bima.
And coming here, I have 2 children, and my husband is a wonderful person who really, I should say, he will never compromise my dreams being not achieved. If I say that this is my dream, and he'll be the first person to plan for it and then make it happen. But he won't
You're one of the
do
fortunate
it
ones.
he wouldn't do it by himself, but he will make sure that I do it, but he will lay the path for it, like that sort of thing. Yes.
Okay. I have a lot of questions, and I'm going to just show them, so any one of you three can answer this. So this is from Chris. Chris does many shows for me, and she's this awesome young lady. So how do we deal with diabetes if it is genetic? Who wants to go?
I think Dr. Haroon.
Okay, if you have diabetes that is genetic, means like the hereditary, that is what I think she is asking.
Yeah.
Our body is like a loaded gun. The triggering factors are irregular food habits, lack of exercise, and sometimes too much stress, and sometimes during surgery you develop diabetes, and then you
Oh,
get yeah,
yes.
sometimes it happens. And if you're given steroids also, you develop diabetes. And these are all, like, different type of diabetes, like not type 1. Type 1 is like, you have that this as Haroon said, that totally we are out of insulin, there is nothing in our body. And so if you have lifestyle changes, then your diabetes will never come to you. You eat on time, do regular exercise,
Yes.
and you don't
Eat on
overeat.
time. That's the most
Yes.
important thing. Eat on time.
We say what you eat is not important. How much you eat is important, and when you eat
Absolutely.
is important. So we say no fasting, no feasting. So if everyone follows that, I think even if you have a very strong history, you can always get, avoid getting diabetes in younger age, or instead of getting diabetes in 30, 40, you can just prolong it. Maybe you'll get it at 80.
Thank you, Bima. I'm
Raja,
going to show an.
Harun,
Yep.
what do you?
Harun, what do you say?
Yeah, look, I think Bima makes a great point there. It all depends on what you eat, and lately, like Nafees was saying, it's just horrifying to see that people are getting diabetes at a younger age, the type 2 one, not the one without the insulin, because of your McDonald's and your Cokes and all of that.
So, fast food.
So
Yeah.
yeah, fast food and in bad dietary habits. So having a dietary good diet is really important. But I think what it also means is that regardless of its genetic or what the cause is, the treatment overall is the same. You watch your diet, you watch your sugars, and you control your sugars, and you make sure you control that in a safe way. And the controlling in type 1 diabetics is insulin and nothing else. In type 2 diabetics, again, I don't mean to confuse, but you can use some medications too, right? So it's about watching what you eat, doing enough exercise, and controlling the sugar. So the treatment for even the genetic stuff is the same. But the message about watching the diet is really important because, especially in India, I think there's been an explosion of
Oh, I
diabetes.
don't think this is everyone Australia. So
Anyway,
No,
it
no,
is
no.
so.
Whether it is India or Australia, we are all from the subcontinent. If people are
yep.
from subcontinent,
Exactly.
they say, they show the love with food. Wherever I go, they will say, oh, no, no, no. You can take little bit insulin, more insulin, and you can eat this. Then I'll say, if you want to show love, just give me money, not food. Next
Yeah,
time they'll not call me.
yeah, I think
Okay.
what Beemajan is saying is very correct. I think mostly the subcontinent, we don't eat to live, we live to eat.
Absolutely. And here comes the next question. So my doctor recently told me that I'm on the border of getting diabetes. Test showed 7.1 sugar. Is it really bad? Okay.
Um, as Harun, can I say something? Are you okay? If it is you, if you want to know really if you have diabetes, you need to get different tests, not just with one sugars. You can't say that you have diabetes. You have this glucose tolerance test, and they take, say, at various interval on a day, and then they give more sugars and check how much your body tolerates and all those things. So that is for type 2 diabetes. But type 1 diabetes, you really get the symptoms. It is really very strong. But type 2 diabetes, without any symptoms, you can go.
Yes, you can go on for years and not know you
Um,
have type
Yeah.
2.
all right. So here's another one. Can diabetes being linked directly or indirectly to glaucoma?
Dr. Haroon, would you like to take that question?
Yeah, look, quite frankly, not that I know of, but with glaucoma, yeah. Look, I think there are some associations, and it's really an ophthalmology field. But as a part of your routine eye checkups, I'm sure they do intraocular pressures too, which checks for glaucoma. In any case, glaucoma is something people will be screened for. So once you go to an optician, they'll be looking for glaucoma, and managing the diabetes will be a part of it. Is there a direct association? I think there may be, but I'm not sure. But certainly, the eye problem that we talk about is behind the lens, right? The where your screen is. So that's something that's directly associated, and I know that glaucoma may be, but I'm not sure.
Okay.
Yeah.
I'm going to. So Kashif says for type 2 diabetes, what to take as main part of diet instead of rice and bread for those who have them as a staple diet?
I think they should meet they should make an appointment with a dietitian, go speak to a dietitian, and then check because just rice or wheat. For me, I eat 3 times rice. For some people, they eat wheat, and it all depends because every body, the metabolism works
It's
differently,
differently.
and
Absolutely.
and also diet is something you check your height, weight, your mainly the body mass index you check, and then the dietitian fixes the how many how much they can eat and things like that.
Yes,
And
absolutely. I think
no diet is a Saleh's diet will be different. The same diet will not work for me. It is like that.
yeah, and I'd like to stress here that you need to know what you've been used to, because it's not it has to be a lifestyle maintenance. It's not for a while that you can do this. Okay, I can.
That's exactly a comment that has come through, which says lifestyle and hello, Dilnaz. So that's
Yeah,
exactly
so
what Dilnaz says. Our lifestyle and habits need to change.
yeah, so it's not about, eliminating one food group and then, after some time, because I think what you need to understand also is your mental health. If it is something that you like, you need to have a good balance between having a healthy diet and, managing your diabetes. You can't, I think, tip the scale on one side, because it will affect you eventually if you are the person who loves your rice, if you are the person who loves your sweet. So I think just having a healthy balance at all times, eating mostly healthy, I think 90% of the times is something I think every individual has to follow. And I think that holds true for every person who has diabetes.
Okay, I have more questions that have come. So here they go. Guys, living with everyday challenges of diabetes, please know that you are admired and respected for the way you tame the beast and get on with life. Oh, may blessings come in the form of eradication of this condition. So that's not a question, that's acknowledgement. Um, and here is
Thank
another
you, Anu.
acknowledgement. So yes, with great
Absolutely.
respect to all, we have so many facilities, support for managing diabetes, so really no excuse. So there is another question. Um, okay, let me first show something for you, Beema. Best ways to keep stress and related diabetes away.
If you're in Sydney, come and see me. Let's go for a walk.
She's in Melbourne. She can't travel to Sydney now.
Can I answer that too?
Uh, I
Can I
know.
answer
I
that?
mean, yes,
Yeah,
Haroon,
yeah.
please.
No, look, one of the things that we didn't talk about is, you know, although it's so, the treatment's also encouraging, like, like both Bima and Nafees said, it comes as a shock to the system, right? You're hit with something that you're so afraid of. So being stressed is normal. See, let's start with that, okay? And then it's being stressed with anything, like anything else in life, right? And what do? Is you confide with people and you talk to them, and you share your experiences, and that empowers you, right? Where I'm getting at this with all of this is patient support groups, right? What the patient support groups do, you might spend what, 10 minutes with the GP, 15 minutes with the GP, 10 minutes with a specialist. But this whole thing about relating and sharing stories and finding solutions, these support groups that are offered by NDSS can be a valuable resource. And that way, you're able to negate your stress and empower yourself. And empowering is an amazing feeling. It really is. It can take away the stress, and all of a sudden you're in control, right? And that's a beautiful feeling. So my message here is, patient empowerment is huge. It's there's so many stories that say that it improves outcomes, right? So reach out to NDSS, reach out to your support groups. Beema has done a lot of work in that, and it's probably a good time for her to talk about the work she's done in India. Amazing work. And it's a very empowering feeling that helps the stress. So I'll shut up here. Maybe Beema can talk about her work.
And then I will
See,
show you
peer
some more
support,
comments that have come through.
yeah, peer support is really very very helpful in managing. I think
Sorry,
I
Bima, can
spoke
I
to.
ask you something? Is there a stigma if you have diabetes?
Oh, of course,
Why?
wherever you go,
Why?
it is a, they call it a shame. That if you people don't have enough knowledge of diabetes, and they'll say you have been eating sugar so much, that is why that means like they make you feel that because you did something wrong you are suffering. And I tell
Wow.
them I have diabetes, I live with diabetes, but I'm not suffering.
Absolutely,
Okay,
Sujima. That was a
it is
wonderful
not,
way
it
to
is
say.
not suffering. And if anyone calls me diabetic, I tell them, if you have hypertension, they are not, are you going to be called as hypertensive? They will call they have hypertension. Like that, I have diabetes, I live with diabetes. There is lot of stigma, particularly when a girl or a boy are trying for a match. If they want to get married, particularly in our culture. There's so many people, they go and ask this girl, like, how long you're going to live? Can you bear children? You know, can you do your housework? Here I am, like for the past 25, 30 years, I should say. I'm 55 now. I work 15 hours a day, not just today. For the past 25 years, like, it is 25 years I came to Australia. I work for 15 hours a day. My normal day is like I work as a health administrator in NSW Health, Monday to Friday, and then I come back home, do the housework, everything, and then by 7:30 I sit, I do advocacy work for children and families. From India, I get calls, at least 10 calls I will get it. I go to sleep around 11:30. Very sound sleep because I'm very happy I have changed certain people's life. And then 5:30 I get up, do my exercise, do everything on on time. And you know sometimes there will be like there is rain or something, there will be changes in our life, like you can't be as a routine of things. But when I go to somebody's house, like particularly they call me for dinner or something like that, first thing I will ask is what time you will give me dinner. Now I tell everybody that I have diabetes, very proudly I will say, and my family is not ashamed of it. But people, there are families who, they're like, when I developed, before I got married, I my food was hidden in the kitchen. I can't sit with everybody else and eat. And the food was like, boiled what do you call that, the lapsi, the
Dalia?
broken with dahlias. They said with that, like I can eat only that. And that sort of, like, I have come across many hurdles I have passed to come to this level. And then unless and until you understand your diabetes, and people say those stigmas and things, don't ever take it into your heart, because health issues will come to only human beings or living organisms. If the diabetes will not come to your laptop or your table or chair, it can come to anybody anytime, isn't it? Nobody knows how their back looks like. So we do get lot of stigmas, lot, and children also they'll say, "Oh, I don't know what your parents have done. You have got diabetes."
Wow. Nafis,
They
did
go
your
to
daughter
that
have to go
extent.
through that?
Absolutely. That's the first thing I think we encountered when I told people around, especially her friends and their parents, when I told them, okay, okay, she's got type 1 diabetes, and uh, if anything, they said, oh, we'll not keep any sugary things. I said, if anything, sugar is a lifesaver for diabetics. So you better keep that around and not have it, because they always feel like, if it's diabetes, it's, no sugar, or nothing like that. But I think what you need, I always tell them that, it's important that you understand that diabetics can eat as, as normal and as healthy as they can, and not have that stigma around that, it's because she ate too many lollies. If anything, my daughter hated sweets and she still hates sweets. So she never was the kind, and I keep telling them, if anything, she loves the savory things, she's never a sweet person. So it shouldn't have happened to her, and if that theory was applied. But yeah, I face that a lot, even in Australia, among people who are, I think, unaware of what type 1 is actually. They all confuse it with type 2, and they feel like, this is what it is, and they know it, and this is their grandparent had it, their mother had it, their father has it, so this is they are all, I think, what they also need to understand, it's very different, and need to learn the current methods,
Yeah,
and not.
first question, if when I tell them that I have children, they will ask that did you pass on to your children?
Yeah.
That is what they'll ask. And anyway, like I think the awareness and the education when you give to people, and people think that, oh, you eat too much sugar, that is why you have got diabetes. Nothing like that.
I'm going to show some, while we're talking stigma, here is some really nice message from Tej Singh. Thanks for answering. I'm going on fasting test in which they check 3 months glucose. I think really appreciate you guys and encouraging people like me. So thank you. Um, I have a question from Deepak, which says, why do sugary drinks like Coke and Pepsi not carry warnings about the risk of diabetes just as cigarette packs do? Who wants to go?
Because I think Coke and sugar does not cause diabetes. I think we just answered that some time back. If you Nobody knows, like Dr. Haroon said, that the theory of why a person gets diabetes, I think, is still an unknown area in medicine. They have not been able to identify why some people get diabetes.
That is type 1 phase. If
But
it
I
is
think,
type 2,
but even for type 2, don't you think, Bima, that even if it's genetic, do you think every person would have it? I, 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 I don't know. Maybe you can answer it
Yeah.
because you are diabetic.
But to answer the question in a different way, I think what you're talking about is, there is calorific content, and why are they not color coded? There's certainly,
Okay.
yeah. I mean, just to interpret in a different way, right? So there's certainly a drive within the among the dietitians and among the health system that you should have this traffic signal color coding. So red is bad, green is good, and orange is somewhere
Amber
in between,
is
right?
like, yep, yep,
So,
yep.
that thing is definitely there, but like everything else, advocacy takes time, and you're contending with people with a lot of money and deep pockets. It'll happen. But it's there. It's there.
Well,
Yeah.
Diba Rizvi says sugar free food in the supermarket is good for type 2 diabetes. Is it true?
I think Bima would know that better.
everything is good for type 2 diabetes. But as I said, what you eat is not important, how much you eat is important. And you say it is a sugar free food, but you have other things in it. It is not calorie free food. It has flour in it, or you have other ingredients. If you see, they will not have only sugar, but they will have fat, they will have other cereals, and those things you have to consider. Okay, if, as Nafi said, if you want to eat something, you eat. You don't have to forego, but eat little, like, small, frequent meals. If you like biryani so much, you can eat 5 times in a day. If it is so tasty, give some gap, and the measure, instead of full plate, have little, so you can, the small, frequent meals is really good for even for normal people, no?
I think another way of putting that is having a constant sugar level, isn't it? Avoiding
Yep,
highs and
yep.
lows. Yep.
The other day, do
And
you remember I sent you a graph of my readings? Do you remember, Harun? It was 94%. It was in range,
yeah,
and that
yeah.
is the small. That is what it gives. I don't have pump or anything, but I take multiple insulin every day.
Yeah.
And that's what I want to talk about. So I want to thank everybody who is commenting. Thank you very much for all your support, encouraging messages. Dilnaz, Hakim, Chris, Deepak. I want to ask both Bima and Nafees about the role of wearables and how would you bring awareness to the community. So let's talk wearables first because that's the important one.
Nafis can speak about the pump and the Dexcom.
Yep. Yeah. Nafees, what do you do for your daughter?
My daughter's still on MDI, but I have all the
Which is
information for
what?
her.
Sorry, what is
It's
MDI?
multiple daily injections. She has a continuous glucose monitor, which she wears and which we have to change every 10 to 14 days. And that gives us a graph. It alerts us when she's above a range or below a range that we'd like her to be. So I have set a particular range is from 4 to 8 for her, that I like her to be usually spend most of the time in range. So currently, I think I would, say that stress on being more in time in range, like Beema said, that she's 94% in range. I think that gives you a good control, avoids complications overall. So I have that, and I have kept it in such a way that I get alerted. And of course, in the beginning, she had a lot of mountains and deep valleys, and I was trying to still learn, but I think that was very informative. Is the graphs, you understand when the insulin starts acting, how the different food groups are, and that can educate you and help you to be more in time and range, and that eventually helps your HbA1cs. I think I that took a while, and I think that data really helped me to understand my daughter's diabetes and how her body reacts. And I think with that, we also have the different types of pumps that are currently available, that they talk directly to the CGMs, that is a continuous glucose monitor, and they can prevent giving insulin when when they're predicting, the algorithm predicts where the blood sugar levels are if they're dropping, where they would be, and if the algorithm predicts that the child is going to have the person is going to go into hypo, and sometimes it suspends the insulin immediately, so
So
that
what is a hypo, Nafees? So you are obviously a medical professional, so you know how to monitor your child.
yeah.
If my child was to have it and she's 4 years old or 5 years old and I'm not a medical professional, what do I do? What
So
would you ask me to do?
you will have a brief, I think, education by the team when you go, and like I said, more than the doctors, the parents or the person who's living with diabetes is the best person who can control, their levels. So they teach you exactly what would the hypo be. How do you Hypo is when the blood sugar levels are below the normal range. You call it hypoglycemia event or hypo event, and you need to treat it with a bit of sugar. Whereas the current sugar or carbs or protein, whatever you need to do to get your sugar levels up again and keep it sustained. The current pumps are available which suspend the insulin, so you don't need to treat your a hypo. And the hypo events are, like Dr. Haroon has stressed, are can be more damaging or have more side effects than a hyperglycemic event. So you kind of eliminate that. And it's always nice to not have too many hypoglycemic events, whether you are on pump or your MDI. You learn that eventually. You kind of, educate yourself and you get to know it. People like Bima, who've lived in an era where I think, we didn't even have blood sugar strips available, and she's living a very healthy, normal, and wonderful life. And she can, I guess, tell you more exactly of, how when she,
The
not being
wearables.
from
Yep.
America. Yeah.
Okay. Like when I was diagnosed, I think we did not have the glucometer. I used to get my sugars checked only once in a month or once in 15-20 days,
So,
like that.
Bima, is a glucometer the one that where you prick your finger
You pick,
and you can
yes,
check?
you
Yep.
pick
Okay.
and
Yeah.
check.
Yep.
So that was available in India maybe in
2000.
90. No, no, 90s it was available. 92 it was available. But it was like, different type of, it was bit harder and, not, like over these 25 years, there's so many things have changed. And but at those days, I think our diet was like, we did not have that much of freedom with our diet. Now we can have that freedom, and we were not traveling that very far and things like that. We were for education, work, and every time we needs to, and we didn't have, we had to take those glass syringes. Not the
Yep.
BD syringes came later, and glasso, and those syringes we had to, and the needles used to be really really thick and long, and we didn't know that it has to be a subcutaneous. We used to just, it used to go in the muscles, and as and when the research just developed, now we are leading a very very normal life, I should say, comparatively. um, and then when the glucometer came, we used to check only fasting sugars, bedtime, and then postprandial. Then every time, and we also got different insulins. Those days we used to have the crude form, the lente, and the very with porcine and bovine insulin, and later on the human insulin was came into the market, and then now we have analog insulins where you take the shot within 15 minutes, it's working. Otherwise, you used to take the shot, and then it used to work after half an hour, and long acting and all those things. Like we used to have pre-mixed insulins
Yeah.
and that sort of thing. Yes, Haroon, you said something.
I just
Harun
want to
wants to.
just add quickly, just to what I think one of the questions, Salia, was, if I become a diabetic, will how will I navigate that? Just to answer your question, when your children or anyone becomes diabetic, the diabetic educator is probably the first person after the doctor who will see you, right? And they will not let you go till you're comfortable with insulin.
Yep.
Right?
Yeah.
Even after you go home, they'll keep a very close eye on you till they're absolutely comfortable that you can manage insulin. And after that, you will become the expert. But till you get the hang of it, no one is going to leave you alone, right? So that's something you can be very comfortable with. And I think again we can be proud of being and fortunate to be in one of the best health systems in the world, right? So we have the resources, and people will hold your hands throughout, and you'll get help when you need to. So nothing to worry about. But
No,
once
we are very lucky. We are very very lucky. At least in here in Australia, like they really hold your hands. They don't let go. And every
So Bima,
hospital.
here it is. I have my chacha watching from India. So he wants you to explain this. So, hello, Lalcha. So, specific diabetic 1 and 2 by which he understands. So, can you, one of you, please explain in simple language? I am very sure he's diabetic. So, I was told by a colleague that type 2 is more common in us than type 1. Is that true?
Yes.
Yeah.
Yes.
Okay.
Okay, last I think I was in a last month. I was talking to people from WHO in regarding these people people with diabetes, people living with the diabetes, PWDs, we called it as, and we wanted to give our thing. And they were saying 80% of the world population, diabetes population, 80% of them have type 2 diabetes, and 20% of them have type 1. But the noise comes from the 20% only. Okay. Harun, you want to say what type 1, type 2 is, or?
Just simple English. If you can say it in Urdu, that is better. If you
I'm not good at
Nafis
Urdu.
can say in
So,
Urdu.
yeah, maybe Dr. Nafees.
I think type 1 diabetes is also known as autoimmune diabetes,
No,
where
Urdu.
Urdu
क्या-
में.
उर्दू में ठीक है। तो टाइप 1 डायबिटीज वो है जिसमें आपकी जो बॉडी है खुद के पैनक्रियास को अटैक करती है ये सोच के कि इट इज कॉजिंग हार्म, इट इज वो आपको वो हार्मफुल है और आपकी बॉडी उसके अपने खुद के पैनक्रियास को अटैक करती है। वो होने के बाद पैनक्रियास का जो इंसुलिन प्रोडक्शन है वो कम हो जाता है या काफी केसेस में बंद हो जाता है। तो टाइप 1 में आप इंसुलिन या तो बहुत कम बना रहे हो या बिल्कुल नहीं बना पाते हो। टाइप 2 में है कि आपकी बॉडी या बॉडी में पैनक्रियास इंसुलिन बनाता है, बट आपकी बॉडी उस इंसुलिन को यूज करना नहीं जानती है। I think, and Dr. Haroon will be able to explain, I think, better in Urdu.
No, I think this is perfect. I'm sure he's got the message. We are way over time because
Yes.
we have so many questions that have come through. Um, before we go, do you both want to talk about your advocacy work?
I think Beema is the best person. I'm just a novice and I'm just starting.
Okay. I started young diabetes club for in Bangalore in 1992,
Yeah.
and 90s, and it was 300 kids, and now, like, most of us are very healthy and we are leading a very normal life. We lost couple of them because of various other reasons, but majority of them are really healthy. And I should thank the doctors who really gave us that knowledge, empowered us with the knowledge to lead our own life. And after that, I moved to Australia, and then here I for Australian community, I have not done anything, but my heart is only in rural India, where the kids are without anything, and a lot of parents cannot afford insulin and that sort of thing. And 2014, I started DCAN, that is Diabetes Community Awareness Network, in my native place. Like, I come from a place called Tirunelveli. I think Haroon only gave me 25,000 rupees for that first time when I started that. And he was my first donor.
Donna? Yes.
And there are 40 kids who are regularly looked after by, like, what I do is, like, I connect them with a sponsor, and the sponsor looks after the kids medication and education sometimes, and then it all goes through the local doctor, whoever is there. And then I started at those times, like, we did not have Facebook and
Social
WhatsApp and
media.
that sort of thing.
Yep.
The communication was not that very well. But in India, there were many people were doing this kind of advocacy work in a very small or very regionally. They were doing things. And then I used to keep in touch with all the regional kids who were doing those, doctors and parents group and all those. They had small groups. And then I was thinking, like, well, how it will be so good that if everyone comes together, and then we from India, there is one voice when it comes to policy changes and things like that, which was really was not very it was not that easy to go and speak to ministers and to the policy makers and things like that. Then on February 29th, 2020, we all came together, nearly 50 groups from all over India. They were so happy to come and join, and we launched Type 1 Diabetes Foundation. And then that was really a hit because even the local government, they joined in, and they were very happy. And still the job, and because of COVID, we couldn't really take it to a higher height where what we planned for, but it is slowly kicking off. And yesterday there was an award. Actually, they gave ambassador awards, one of the doctors, and he's very well known. And of
Congratulations.
course,
Yes.
is of course in India there are many doctors who are really doing a lot of work for type 1 diabetes or diabetes in general. They do a lot of research, and they you can't say that medical care is not that very good in India. Generally you can't speak, because there are exceptional hospitals and places where they really treat. See, I was trained in as a diabetes educator in India, and I manage my health, and I also work as I give counseling for children in living in India. And I think by in another few years, like NDSS, there will be something in India.
Good.
See, because I come from India, I can speak about that. That is the
Thank you.
dream.
Yes. That is your dream. Inshallah.
Thank you.
Um, Bilkis has just joined in. Bilkis, hello. And sorry, we have to end now. We have gone like 15 minutes over time. Thank you all so much for joining me tonight. It has been really amazing listening to all of you and sharing your thoughts with us. And thank you to everybody who's logged in, joined the conversation. Thank you very much.
Thank
Good
you.
night. Be
Thank you,
safe.
Saleha. Thank you,
Okay,
Haroon.
Bima.
Thank you,
Bye.
Nafees.
Bye, Nafees. Bye,
Bye.
Haroon.
Thank
Bye.
you.